Three knocks because it's Friday. Hi, everybody. We are opening the Subcommittee on Health Professions of the Senate Committee on Education and Health. If we could call the roll.
Senator Pekarsky.
Good morning, I'm here.
Senator Head. Here. Senator Bagby. Here. Senator Pillion. Senator Boysko.
Here.
You have a quorum, Madam Chair.
Thank you so much. Senator Craig is up with SB 661. If you would like to tell us about your bill, if you have any amendments, if you'd let us know that in advance.
No amendments, yeah.
All right.
Okay. Good morning, thank you. I have Senate Bill 661, and Senate Bill 661 was brought to me by a constituent from Chesapeake, my district, and it deals with nursing homes and his desire to be able to allow patients and families to put cameras into private room only so that they can keep an eye on their family. He had an issue back in the district with his mother-in-law and his brother-in-law. They were in the same nursing home, and they were both neglected. His mother-in-law had fallen, and they didn't let anyone know, and so 3 weeks later, they get her to the hospital. She'd broken her hip, and you know, when you're that old and you break a hip, usually you don't last long. They brought her back to the nursing home 3 days later after she recovered and she passed away. So he serves on the Chesapeake Task Force for Aging, and I also am a member of that, and this was one of their agenda items that they asked me to bring forward. Senator Cosgrove put this bill in years ago, and I worked with all the stakeholders, and it back then it was private rooms and shared rooms, and if it was a shared room, you had to get the permission from the person that was sharing your room. And so it went through to the Virginia VDH, and they promulgated regulations, but only allowed it to be a may. The nursing homes would have to approve this. So I'm bringing this bill to you today on behalf of my constituent that he would like it to be a shall, and of course the parents or the patient would absorb every bit of the cost, installation and everything. And so, you know, we have doggy daycare. You can go on and watch your dog at his, you know, the daycare when you travel. And we make police officers wear body cams so we can know what's going on. So this is just, you know, it's more for patients that have dementia, and parents and their loved ones are just wanting to make sure that, you know, they're okay. Imagine if we would have had it during COVID. We could have, maybe a lot of people wouldn't have just died of loneliness, and they could have at least interacted with their family via a camera rather than standing outside in the cold waving to them from a window. So this is the gist of the bill. I've worked with all the stakeholders. I know that they don't support this, and you know, I wanted to let them know that this was a constituent bringing it forward, and I do believe in that there is an issue with this, and I understand their concerns, and so it's just the will of the pleasure of the committee for today.
Thank you so much,
Thank
Senator
you.
Craig. Did you bring anybody who
He
want
could
to
not
speak on
make
the bill?
it. He did send me his little statement. That's why I'll let you know about his mother-in-law and his brother-in-law being neglected in a home in my district.
Okay.
And I've talked to the stakeholders about that and let them know the facility. I don't want to mention it now, but I've let them know of the facility.
Thank you.
Thank you.
Are you aware if they had any follow-up with the facility? Was there any
I'm not sure.
agreement?
His wife worked there as well, so she
my.
saw a lot more. And I think that's why he asked me to bring this. And of course, he serves on the Council of Aging in Chesapeake as well as I, and that's why he is very passionate about this issue.
Thank you so much.
you.
Questions from any of the members? Is there anyone in the audience in support of the bill? Is there anyone in the audience in opposition to the bill? Right, Mr. Johnson.
Members of the committee, Scott Johnson, appearing before you as General Counsel for the Virginia Healthcare Association. I want to thank Senator Craig. She called us about this bill, pointed out on line 6 there that it's a by request bill. We've had a lot of communication, and her door has been open. But we do oppose the bill because, as she articulated, back in 2018, you had VDH promulgate regulations on this. And if I may hand out copies of the regulations to Senator Pillion and Senator Head down there. She's right. This issue is already covered by regulations. We would not favor a mandate being put in statute on this. I draw your attention on the first page to paragraph C, where the regs say we can't refuse to admit or can't discharge or basically kick out a resident if they want to do electronic monitoring. We're not adverse to electronic monitoring, but we got to respect the privacy. And you can have a single room, but if your door's open and the camera's facing the hallway and a resident goes by disrobed, you got to make sure that that's handled well. So we would respectfully ask you to gently lay this bill on the table. We'll continue to stay in touch with Senator Craig and make sure that she's got what she needs to get back to her constituent. And I thank you.
Thank you so much. Yes, if you'd introduce yourself and tell us how you feel.
Hello, I'm Dana Parsons, Vice President and Legislative Counsel with Leading Age Virginia, and we too greatly appreciate the Senator's concern about this issue, which goes back many years. As Mr. Johnson mentioned, all nursing homes are required by statute to provide policies about whether nursing homes permit electronic monitoring or not. We don't oppose it, but the current framework that's in place is working well, so we don't think a mandate is necessary. We also have two nursing home providers here that can answer any questions for you.
Thank you so much. Are there questions from the members? Okay. We operate by motion. Is there a motion?
Madam Chair, I certainly appreciate the senator bringing this bill to our attention, and as we've already heard, I think the best thing to do with this bill is to gently lay it on the table.
So would that be a motion to pass by indefinitely,
That's-
gently?
Yes, yes.
All right. If the clerk would call the roll, please.
Senator Pekarsky? Senator Head? Senator Bagby?
Yes, by proxy.
Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, noes, or excuse me. Yeah, ayes 5, noes 0.
The bill is passed by with a gentle consideration, 5-0.
Thank you so much.
Thank you for bringing it. I think
Thank
it's
you. Y'all have a
important.
wonderful Friday.
Keep those. The next bill we have is Senator McDougal. That is SB 607.
Waiting on you.
Senator McDougal, why don't you tell us about your bill?
Madam Chairman.
Do you have any amendments
Yes,
before we
Madam
start?
Chairman.
Okay.
Do you want me to tell you what it does first and then what we took out?
Let's have a motion to approve the minutes.
So moved.
All in favor? Aye. Any opposed? All right, please tell
And
us.
Madam Chairman, the amendments take out the references to out-of-state central fill locations, and in the first place on lines 21 through 23, and then out-of-state on lines 24, and then change on lines 44 through 46, strike the specific references to ratios between pharmacists and technicians and interns, and that would allow the board to retain that authority instead of us prescribing it in the code. Those are the two separate.
Thank you very
amendments.
much. Can you describe what your entire bill
Ma-
does?
Madam Chairman, so a couple years ago, the board granted a waiver to do a pilot project for a central fill location. So what happens is prescriptions would come in and just go to a pharmacy group, and it would be centrally filled in one location. So it's done robotically with a pharmacist overseeing that, and they can do somewhere between 385 different fills in 1 hour per each robotic unit, which is pretty astounding. And then they ship them back to the pharmacy for them to be delivered and packaged. So there's a location that's been built now in Virginia to do this. So this would allow that location to continue past the pilot waiver that was granted. Madam Chairman, I think this committee has probably heard more so than I have that particularly our pharmacists and the technicians are just overwhelmed, and the vast majority of what the central fill is doing now are this, I think if I recall correctly, it's less than 1,000 prescriptions that are repeated over and over. There are some more specific types of things that need to be refrigerated and all that the facility has the capacity to do, but this really takes off a lot of the repetitive focuses so that pharmacists can focus on what they actually need to be doing, giving advice to patients, making sure that they're not giving prescriptions that overlap negatively with each other, things of that nature.
Thank you very much. Are there questions for the patron? Senator Pekarsky.
Thank you, Madam Chair. You mentioned to the senator that this was a pilot, so I assume if you're bringing it forward, there have not been any issues with this. I don't know if there's somebody who can speak to it.
Madam Chairman, there've been a lot of people in my office lately, and none of them have expressed issues with the current. Everybody wants more. So what we did with the amendments is limited. This has to be produced in Virginia so that we would retain control. So this would not allow a central fill pharmacy in another state to ship into Virginia. It does allow Virginia to ship to other states, but we're limiting it. So our Board of Pharmacy will retain control in the future.
Thank you. Did you bring anyone with you?
Madam Chairman,
who'd like
there
to
are
speak on the
probably a
bill?
lot of people here. If you want to hear
Well,
from them, great.
I mean, we could just, if you'd like to come up and just briefly tell us if you support or not, we don't need to spend hours on this, I think.
Madam Chair, members of the subcommittee, Jody Roth on behalf of Virginia Association of Chain Drugstores, and we just would like to thank the senator for bringing this bill forward for our member. It will, as he already mentioned, allow them to provide them more time with the patients. They will not, the central fill location does not have any contact with the public, and so it just, we all are aware of the workflow and the burden in our pharmacies now, especially since the pandemic, and so I think this will help alleviate some of that.
Thank you.
Thank you.
Come on forward, introduce yourself.
Good morning. Howard Estes. Sorry. Howard Estes, Estes Law and Consulting. I represent the Virginia Pharmacy Association, with the technicians as well as the pharmacists. We had just those two issues with the bill. We think the Board of Pharmacy can provide the best oversight for these facilities, and we think that having these in-state will protect patients and make sure that we've got good oversight. So we thank you for working with us.
Thank you so much. And are there people in opposition to the bill? Seeing none, is there?
Need to report.
All righty. If the clerk would call the roll.
Senator Pekarsky? Yes. Senator Head?
Yes.
Senator Bagby?
Yes, by proxy.
Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, no 0.
Thank you. Your bill recommends to the full committee 5-0.
Thank you
for
Thank
bringing
you,
it
Madam
forward.
Chairman. Does that mean I don't need to be at the full committee?
That's correct.
That's beautiful news.
Thank you.
That's the best thing I've heard all day,
Yes.
maybe even all week.
Thank you. Senator Deeds with SB 568, if you would join us at the table.
568 is a bill that I worked on with Professor Andy Block at UVA's clinic on state and local government. And one of his students, Allie Howe, is here to answer technical questions about the bill because she's probably better equipped to do it. I think there's a substitute, and I think it incorporates some technical amendments. Is that correct, or do we still need to make the technical amendments? Okay, the
All righty.
substitute.
Is there a motion to accept the substitute? And second. All in favor? Aye. Okay.
What 568 is about is giving the ability to behavioral health care facilities and crisis receiving centers the ability to get medications in a timely fashion to people who are in crisis. It creates a framework that authorizes these facilities to utilize a remote dispensing systems and automated dispensing devices that would enable them to prescribe and administer medication without delay to the individuals in need. That's an essential tool to get these people back on their feet. It's also a critical part of the safe management of patients in crisis receiving centers and residential crisis stabilization units that are a component of the governor's Right Help Right Now initiative. Nursing homes are not included in the legislation. Nursing homes are already permitted to use automated dispensing devices. I think the bill has been reviewed by the Department of Health Professions, and we're not aware of opposition. There's an emergency clause on the legislation, so this work can begin quickly. As I said, Ally's here, and she's the expert.
Thank
So,
you.
I'd
Yes.
invite you to grill her.
All righty. Are there questions from the members? Ally, would you like to speak on the bill a little bit? Just clarify some stuff?
Sure. Good morning, Madam Chair, members of the subcommittee. My name is Ally Howe. I'm a student at UVA Law and member of the State and Local Government Policy Clinic. The views I express on my own. Over the past few months, I've had the privilege of working with Senator Deeds, along with many others, on SB 568, and I'm here today to ask for your support on this bill. SB 568 does three things. First, the bill directs the Board of Pharmacy to allow facilities that provide crisis stabilization to have secure, pharmacist-controlled, on-site access to a full range of critical medications in the same manner as state hospitals do. This will allow these facilities to better, more safely, and more quickly serve people in crisis. SB 568 also allows nursing homes to have certain medications on-site. This will alleviate the pressures of finding off-site pharmaceutical providers, the burden of which may otherwise impede patient care, especially in rural areas. Finally, SB 568 includes an emergency enactment clause to ensure these desperately needed updates are implemented as quickly as possible. The improvements SB 568 provides will allow Virginia to take full advantage of its expanding continuum of crisis response services, relieve pressure on state hospital capacity, and ensure more people can receive the care they need in smaller settings and closer to home. Patients, providers, and policymakers all agree that this bill offers critical tools for building out our new crisis response system. Thank you so much for your time, and I ask for your support on SB 568.
Thank you so much. Any questions?
Just clarification, all this is doing is utilizing technology that speeds things up and allowing the crisis response centers to have the same access that nursing homes already have. Absolutely. Right? Madam Chair, move to report.
All righty, second. If the clerk would call the roll.
Senator Pekarsky?
Yes by proxy.
Senator Head? Yes. Senator Bagby?
Yes by proxy.
Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, no 0.
Thank you so much. Okay, is it accurate that Senator Suderline requested that we pass his bill by for the week? I have not heard either. He is not. Yeah. And there's only one bill left that has no controversy whatsoever on it.
Let me call him first.
Okay. We'll just jump into that, and I'm just going to sit here. All righty. All righty. This is SB 351. It would allow the Board of Medicine and the Board of Nursing joint license, dealing with the Board of Nursing joint license and advanced practice of registered nurses. This is a proposal that embodies common sense and aligns Virginia with the broader national trend in healthcare regulations. This bill is about simplifying and streamlining the licensing process for our advanced practice registered nurses by removing redundant professional regulation. At present, Virginia is one of the only 3 states that requires an additional layer of regulatory approval for APRN licenses through the joint boards of nursing and medicine. This is not only an anomaly, but an unnecessary complication in our regulatory framework. Senate Bill 351 proposes a sensible adjustment to bring us in line with the majority of the United States. It is important to clarify what the bill does and what it does not do. This is not about diminishing standards or oversight. Instead, it is about administrative efficiency and consistency. The Board of Nursing, which already plays a significant role in licensing APRNs, is well equipped to handle the responsibility independently. This bill is about meeting our workforce needs. At this time, 40% of the graduates from our nursing programs in Virginia leave the state for jobs with less restrictive regulations. I know there are a lot of people who are here in the room who have a variety of opinions on this. I know it is controversial. We have had extensive discussions with the the regulatory professions who are dealing with this, as well as the doctors. And I would ask if anybody is here in support of the bill to come forward. And we're going to try not to spend 3 hours on this if we could, try to keep our comments timely. Let's keep our comments to 5 minutes per side. 5 minutes total per side. Yes, and if you would hit the button, introduce yourself and tell us so we can hear you. Yep. Introduce yourself and tell us who you are. The green button should, there you go. You did it.
Scott Riggleman with Americans for Prosperity. We support the bill because it does streamline the licensing process and appreciate you carrying it.
Thank you.
Hi there. I'm Ashley Apple, Virginia Nurses Association. I'm a nurse practitioner and professor of nursing. 50 years of empirical data that proves the quality and safety of advanced nursing practice. 27 states and D.C. have full practice authority, which by definition means they're regulated solely under the Board of Nursing and they allow independent practice. There's no evidence that a joint board provides any benefit to the public. In fact, it may cause harm. The Federal Trade Commission warns that when states allow regulatory oversight by physicians, quote, they effectively give one group of healthcare professionals the ability to restrict access to the market by another competing group. And to be clear, in this case, the market is healthcare. The FTC calls this practice anti-competitive, citing the risk of physician bias due to professional and financial self-interest. These competitive costs should not be imposed on the public without compelling evidence of benefit to health, safety, or consumer protections, and there is no such evidence. We ask you to help us fix this. And here's the Federal Trade Commission report for you. Appreciate it.
3 minutes and 48 seconds.
Good morning. My name is Nicole Wardlaw. I'm a certified nurse midwife. I live and work in the Hampton Roads area. I have a practice, and I'm also one of the midwives that started a midwifery practice in Hampton, which is a medically underserved area. My concern, and I support SB 351, my concern is always the address of the lack of maternal care clinicians. We are in maternal care desert in our area. Streamlining the midwifery regulation through the Advisory Committee of APMs, which is Advanced Practice Midwives, to the Board of Nursing, is an important step to modernizing the Virginia midwifery workforce, which has yet to achieve the World Health Organization's recommendation of a minimum of 6 midwives per 1,000 births. When there are delays in the licensure, the health of Virginians overall suffers. I personally worked on the 2021 Certified Midwife Bill because the care of practice by midwives is one key proven way of improving maternal and perinatal mortality. Right now, as of February 2024, we still do not have certified midwives licensed in our state, only because of that regulatory bodies and the red tape. So I would ask that you support SB 351.
2 minutes and 23 seconds.
Hi there, I'm Alicia Pack. I am the Virginia Council of Nurse Practitioners President-elect. Just a couple of poignant comments. I ask that the hypocrisy of the opposition to this bill is not lost on you. While on one hand they point out that NPs are not physicians in any way, shape, or form, and we agree, we are not, they remain adamant about having NPs regulated by physicians, an entirely different profession. The most important part of the role of nurse practitioners is nurse. The Board of Nursing, with the requisite expertise in nurse education, training, and practice, is the entity best suited to regulate NPs, which is the standard in 46 states and D.C. Unnecessary restrictions of APRNs negatively impact patient choice, access, economic growth, entrepreneurship, and the regulatory cost of health care. This is a common sense and cost-efficient step. We ask that you support Senate Bill 351.
1 minute and 25 seconds.
1 minute and 25 seconds.
Good morning, good morning, members of the committee and chairman. My name is Karen Kelly. I'm a certified midwife, and I'm the president of the Virginia affiliate of the American College of Nurse Midwives. I would like you to pass this bill because Virginians deserve confidence in a well-functioning regulatory process that isn't weighed down by unnecessary red tape. Advanced practice nursing and advanced practice midwifery are unique professions made up of individuals who've completed at minimum a graduate level education, adhere to specialized training and standards of care by their individual professional organizations, and practice distinct disciplines that may have similarities to medicine but are their own unique specialty. Even ACOG, who is the profession that midwives most frequent, represents the physicians that we're most likely to work alongside, support that midwifery is a distinct individual profession separate from medicine. 3 studies so far have been submitted by the Department of Health since 2021 supporting this change, and in review of other health profession boards in Virginia, they are uniformly composed by professions they represent. The Board of Psychiatry is made up of psychiatrists, the Board of Pharmacology is made up of pharmacologists, the Board of Optometry is made up of, you guessed it, optometrists. While you could argue that their roles share overlapping areas of practice with physicians, they do not have medical doctors on their regulatory boards. Passing 351 is a necessary initiative to show that Virginians are in good support. Thank you.
Thank you very much. If you just quickly express your feelings.
Yes, ma'am. My name is Josh Carlson. I'm a nurse practitioner, and I come to you as a vet. So I served in the United States Navy.
That's all if you just say yes, that's all I wanted to hear. Thanks from you.
Virginia, we support the bill.
Thanks. Is there anyone from the administration?
Aaron Barrett, on behalf of the Department of Health Professions, we support the bill.
Thank you very much. I appreciate it. How about the people who are in opposition? We'll have 5 minutes for that.
Madam Chairman, Scott Johnson, General Counsel for the Medical Society. Let me first say, this is not about doctors hating nurse practitioners or midwives. We need each other. We work together. It's a difference of opinion over training and what is established. Thank you, too, for your time. You've been very gracious in meeting with us and all of that. We have had the Joint Boards of Medicine and Nursing for a long time, and the boards work. There are some wives' tales out there about the boards don't meet and don't do any discipline. So, Madam Chair, if you would hand out to your fellow members there, you see since 2018, the boards have met 73 times. There is one set of regulations that govern the practice for midwives that is in place, but the large part of what the boards do is do discipline, and that's what you want. You want clinical experts in the room doing that. The other thing you need to be mindful of is this is a sequence issue. If the joint boards are eliminated as is proposed in this legislation, the next step is going to be a nurse APRN joining the compact. And once you join the compact, the language on page 6 of the compact itself says that nurse practitioners can practice without supervision or involvement of physicians. I'm going to cede my time to the other expert witness we've got here, but I ask you to gently lay this bill on the table. Thank you.
Thank you.
3 minutes and 40 seconds.
Good morning, Madam Chair. My name is Kathy Scarbalis. I'm a PA, a physician assistant, with over 40 years of practice experience, and 20 of those years being here in Virginia. The other 20 were worldwide. My husband was in the Army. I stand in opposition to this legislation, which would dissolve the Joint Boards of Nursing and Medicine and consequently establish 2 separate and distinct paths of oversight and discipline for licensees practicing medicine in the Commonwealth. To be clear, NPs, PAs, and physicians all practice medicine, meaning that we all diagnose, treat, and prescribe. I am the immediate past chair of the Physician Assistant Advisory Board to the Board of Medicine. In this role, I chaired disciplinary cases for PAs. Members of those boards were PAs and physicians. NPs should have the same. They practice medicine, and others practicing medicine should hear the case. If the joint boards were dissolved, NPs would be regulated and have disciplinary cases overseen only by the Board of Nursing. The Board of Nursing is only required to have 2 advanced practice registered nurses within its membership and is by design made up of a majority of members who are registered nurses and licensed practical nurses. The valued RNs and LPNs do not have training in medicine, and to practice medicine and adjudicate a case of misconduct for an APRN that is practicing medicine would not create fair outcome. This disparate outcome for patients and providers is not fair to patients or providers when it comes to patient protection. I ask that you maintain the joint boards and ensure that all practitioners in Virginia who practice medicine are treated at the same standard. Thank you.
Thank you very much. I appreciate your testimony today. This has been something that we've been talking about for years, and I know that there are very passionate opinions about it. This committee works by motion. I will move that we report the bill. Is there a second? Okay. Hearing none, it appears that the bill will not be reporting. Fails to report. Do we need a vote, or there's no vote?
Madam
How
Chair,
do we handle
there's
that?
no motion on
There's
the
no
bill, so
motion.
that it does not fail to report. It is simply still within the body of the committee.
Okay, thank you very much. Appreciate everybody. And Senator Suderline has just arrived in the nick of time. Senator Suderline, your bill is SB 682. Would you tell us about your bill?
Yes, Madam Chair. I have a substitute, which I think council has. Thanks.
Is there a motion? Motion to accept that substitute. All righty, all in favor? Aye. Tell us about your bill. And how
Thank you,
it's
Madam
changed.
Chair. So the substitute before you creates a work group with the Department of Health Professions, Secretary of Health and Human Resources, Secretary of Labor, and several constituency groups such as the Medical Society of Virginia, Virginia Nurses Association, Virginia Pharmacy Association, Virginia Dental Association, and the Hospital Association, and other groups that might seek to be a part of it, to work to see what could be done to increase the chance of universal licensure of various healthcare professions here in the Commonwealth.
Excellent, thank you. Questions for the patron?
Madam Chair, Senator Suderline, so although this is just a work group.
That's exactly right.
Okay, all right.
Okay, you have,
Mid-report.
all righty. If the clerk would call the roll.
Senator Pekarsky?
Yes, by proxy.
Senator Head? Yes. Senator Bagby?
Yes, by proxy.
Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, no 0.
Okay, your bill reports to the full, recommended report to the full committee.
Thank you, Madam Chair.
Thank you, everyone. The committee will rise.
Senate of Virginia.